Welcome to this series of microlearning modules focused on putting healthier food service guidelines into action. The goal of our online series is to educate and empower public health practitioners to partner with community institutions and large employers to design healthier food service operations that support population health, local economies, and the environment. This online series is funded by the Centers for Disease Control and Prevention and was developed in collaboration with the National Association of County and City Health Officials. Who helps develop an FSG policy? As a first step, you'll need to consider who needs to be at the table to develop, draft, approve, and eventually implement your FSG policy. Here are some key groups to consider including during policy development. Worksite wellness staff or on-site dietitians, local health department experts, procurement, acquisition, and/or contract administration staff, institutional leadership, food service managers or directors. Once your team is on board, it is important to understand the different types of FSG policy options, statewide or municipal level FSG, and organizational level. A statewide or municipal level FSG policy is usually adopted by a policy-making body, such as a governor's executive order, an agency-issued regulation, or a bill enacted by the state legislature. These are sometimes called Big P policies and have the weight of the law behind them. Such policies may have significant population reach and public health impact. These policies often impact food served and sold on all government-controlled property, including public parks, government worksites, or state buildings and facilities. They usually have wide reach and potential public health impact. However, they also face more upfront challenges to their adoption, such as a changing political environment, interest group opposition, or even state budget concerns. Organizational level FSG policies are the focus of this microlearning module and are another type of policy option. These policies are under the direct purview of any public or private organization. They are sometimes called small p policies because their reach and impact is limited to just the organization's workforce and buildings. However, they can still embed FSG standards directly into food service contracts or permits issued by the organization, food purchasing or procurement agreements, or institutional worksite wellness policies. They can be highly effective at changing the food environment in your workplace or institution. Both types of policies are standards designed to achieve the availability of healthier foods and beverages and encourage their consumption by employees, visitors, and patrons at private and public institutions and organizations.